Hi, friends. Today, I decided to start a series of lectures on the topic of cholesterol, and they all will be marked cholesterol 1, 2, 3, and so on. Here in this lecture, we are going to talk about group of drugs that will help to lower cholesterol. Here on the right, you see a picture that describes my feeling about cholesterol-lowering medications. When I was a young graduate from the medical school, the level of cholesterol was 300. The medical profession lowered the standard. It's decided to do it 200. So as a result, we know the cardiovascular disease was and remains #1 killer in the Western world. However, in the process, we created a lot of new patients. We put a lot of people on cholesterol-lowering medications. So net effect is negligent, to say at least. So in this series of lecture, I will do a couple of things for you. Number one, I would like to give in every single lecture a little bit background of biochemistry. So I will push you just a little bit. I'm not going to give you heavy duty biochemistry, but I want to bring your educational level a little bit higher so you can argue with your friends or with your primary care physician when they want you to push medication, so you will push back. The second is almost in every video, I will be giving you a little bit of pearls. I don't want to say I will give you a secret. It's like selling proposition. No, a little bit more information where I said, this is important. I will use this information in the future. Like when you need to change the diet, I will tell you why. So, and you can refer to this, to my previous videos. So let's go ahead and let's start. So we are talking about group of drugs that usually prescribed by medical professions to low level of cholesterol. So I will talk about all of them really briefly, except statins, vitamin B3 and omega-3, because I plan to do a separate videos on those topics. PCSK9 inhibitors, the group of drugs I never prescribed in my life. And by the way, I almost never prescribe statins or any cholesterol-lowering medications, except supplements. Most of my practice was take of people of these medications, make the dietary changes, put on supplement, so something benign. So this group of medications is usually given to people with familial hyperlipidemia. That means that the people have a family history of cardiovascular disease. They have a much higher morbidity and mortality from heart attacks and strokes, and you can actually trace it in the family. And patients will say, my grandfather, my father, my older brother, they all died in early 50s or even 40s, and the cardiovascular disease start in later 30s or earlier 40s. And these patients will be presented in the clinical settings with fat deposits all over the body. Like here you have an example of fat deposit in Achilles tendon. They have usually deposits here along the on the face, and they will have called arcus senilus at early age. Means this a white circle called also cornea arcus at early age, means that there are changes in cardiovascular system. There are fat deposits there. So those type of patients, you see them, you send them to cardiologist, and cardiologist prescribes and monitors. Fibrates, the group of drugs that act on RNA inside the cell, and it's they act the way that it will decrease production or reduce the level of triglycerides, decrease production of very low density lipoproteins, increase level of high density lipoproteins. Along that, it will create few side effects such as myalgia, means muscle pain, sporadically rhabdomyosis, means muscles get broken, and debris of muscles get released, and it will be detected in the urine, and it's quite painful because it acts on RNA of the cells, and particular RNA of liver cells. You will see changes in the liver enzymes. ALT and AST will get elevated. The quality of bile will change. As a result, patients will start to create gallstones. Bile acid raisins, they act on blocking reabsorption of bile acids, act right here. So here is the liver. Liver takes cholesterol from the bloodstream, converts them into bile acids that they get released into the small intestine. The purpose of the bile acids there is to break down the fat to make sure that it gets absorbed. Bile acids, about 98% get reabsorbed back into the liver, and this is get reused again and again. When you block the reabsorption, what happened? The cholesterol started to get drawn from the blood. The level of cholesterol in the blood will go down. However, because the action is blocking reabsorption of bile acids, a lot of this bile acids will stay here in the small intestine. They are not belonging there. They will go into large intestine. They don't belong there, and will go out of into the stool. So what does not belong here in a high concentration will create inflammation in the small intestine. As a result, side effect of this drug: constipation, stomach pain, bloating, gas, heartburn. A lot of my subscribers for acid reflux do not know that the problems in the small intestine will eventually create acid reflux, loss of appetite, blah, 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 blah. Now, vitamin B3, I will create a separate video. If you decide to go ahead and make sure that it's non-flash niacin, or also called flash-free niacin. It will block release of fatty acids from the liver, and it's not going to be picked up by the liver, so the liver is not going to produce very low density lipoproteins. Ezetimibe. So this drug is working by blocking cholesterol absorption from the small intestine. I love this picture because you can see those different groups of medications, how they act. Here is your PCSK9 inhibitor, so they act by blocking this. As a result, less LDL get produced, so the total cholesterol is low. So here you can see statins, when they enter here, they block conversion of acetyl coenzyme A into cholesterol. Cholesterol is decreased. As a result, less LDL get produced. So, and here is Ezetimibe. Here it is. And what's interesting, the side effect almost the same as in placebo. Now the next is Nexletol. Also back to this picture. This is blocking conversion of citrate to coenzyme A, to acetyl coenzyme, to cholesterol, and less produce LDA. So you can appreciate this picture. Now, the products that I was talking about. Here on the left, you see the blue is the picture. It's going inside the cell. When people eat a lot of simple carbohydrates, glucose in our body is used for energy purpose. So sugar get converted into pyruvate and lactate. From pyruvate, it's shunted within the cell into mitochondria. And in mitochondria, it's used to produce energy. Energy is everything for our life. All right. There is a shunt here that converts from Krebs cycle from citrate convert to acetyl coenzyme A. This one. Acetyl coenzyme A, it will get converted to cholesterol, and LDL will get produced. So Nexletol blocks this conversion. And from acetyl coenzyme A, you can see this arrow goes to de novo lipogenesis, means de novo, new lipo, fat genesis formation of new fat. It's basically that. So you will form. So this is the keyword. People who eat a lot of sugars food, they can produce a lot of fat, a lot of cholesterol, and that fat will get actually deposited in fat tissues. So that's why people who consume a lot of simple carbohydrates tend to be obese. Now, bottom line is what I want to say. People who actually will benefit drastically, the group of the people that benefit from cholesterol low medications are people who have familial hyperlipidemia. The rest of us, we just take it. When you read the information on or listen to information on YouTube or anybody, they will say, 7 people have to take statins in order for one person to benefit. That's what they are talking about. So many people will take statins, and only one group of people who have genetic predisposition for cardiovascular disease will benefit. The rest of people will just suffer from the side of those prescribed medications. So if you have any questions, please ask, subscribe. Bye-bye for now, guys.